Hello everyone, today we have here with us Dr. Siddhartha Mani, Interventional Cardiologist at NH Rabindranath Tagore Institute of Cardiac Sciences, Mukundapur. He regularly performs various interventional procedures like coronary angioplasty, pacemaker implantation, AICD and CRTD implantations. Heart disease is one of the main reasons of death and morbidity in today's world. Even the younger people are suffering from heart disease, especially a heart attack. So sir, we would like to know in detail what do we understand by the term of heart attack?
See, our heart is basically an organ which is like a sac, and it is surrounded by muscles. So the blood is filling inside the sac like this, and when the heart is pumping, the muscles are contracting and the blood is ejecting out. So basically our heart is pumping like this, and it is circulating the blood in the entire system and all the organs. Now these cardiac muscles, they get their blood supply from three arteries which are called coronary arteries. These coronary arteries are lying on the surface of the heart, and they are carrying blood to each and every muscles of the heart. Now what happens during an heart attack is, these arteries, either one or more of these arteries, get blocked with time with different diseases that we will discuss later, and gradually the block increases and increases, and ultimately when an artery is totally blocked, say 100% blocked, then the blood supply to the heart muscles is totally cut off. Now then some portion of the heart muscles are not getting any blood. This is what we mean by heart attack. So at that moment the blood supply is cut off, the muscles are dying. The more time elapses, more and more heart muscles dies. Now think, suppose this portion of the muscles are not getting blood from an artery. Now so these muscles are gradually getting dead and non-functional. So the heart was previously pumping like this. Now this portion is not pumping, so the heart is pumping like this. So the entire force of the cardiac pumping is decreasing. So patient is having chest pain, shortness of breath, patient may develop syncope, patient may develop many other complications like arrhythmias or sudden cardiac death. So this is what we mean by actually heart attack.
So sir, as you mentioned, so what are the causes of heart attack actually?
See, basically the cause of heart attack is blocking of the coronary arteries. Now the pathophysiology behind this block is atherosclerosis. What is atherosclerosis? Now these blood vessels have an inner lining or a thickness. In the inner lining of the arteries, there is gradual deposition of different substances like cholesterol, like calcium, like different other blood cells, dead cells, and gradually with time these depositions, they keep on increasing, and sometimes there occurs ruptures or erosions on the surface of these depositions. Now whenever there is a rupture or erosion, red blood cells and white blood cells, they tend to sit in that erosion or in that plaque, and they gradually keep on increasing, forming a blood plug, which we call a white plug or a red plug. Now this plug of blood cells clog the blood vessel, block the blood vessel, and within few minutes or hours the entire blood flow is cut off. So this is atherosclerosis. Now you can say, why do atherosclerosis at all occur? Now there are different etiologies for that. Basically with age, each and every one of us will have some sort of atherosclerosis in all our vessels. But the process of atherosclerosis increases when there is hypertension, diabetes, or if the patient is a smoker, or the patient has some dyslipidemia like cholesterol or triglyceride problems, or patient has a family history, and there are certain other risk factors, unusual risk factors like homocysteine, apolipoproteins and all those. So these are certain risk factors which will aggravate this process of atherosclerosis. And once this atherosclerosis gradually blocks the lumen, and as I said, there will be a erosion or a rupture, and then over that there will be a blood clot and the artery blood flow will stop.
Okay, and sir, as you mentioned in the previous question, like shortness of breath and even chest pain are the symptoms. Other than that, is there any other major symptoms that like we can understand of heart attack?
The actual main symptom of heart attack is chest pain. But before I say about chest pain, you have to understand that there are few groups of patients like diabetic patients, like very elderly patients, or sometimes females, they don't complain of chest pain at all. So sometimes other symptoms other than chest pain, like as I said, shortness of breath or sweating or syncope, that is the patient getting unconscious, these symptoms can be symptoms of heart attack also. But the major symptom is chest pain. Now during heart attack, usually the chest pain is very severe. It is a compressive or a heaviness sort of chest pain. Patient will complain that I feel something very heavy, a heavy stone is put on my chest, like that. Or somebody says that my chest is getting compressed with a belt. So it is a compressive sensation or a heaviness which occurs along with this shortness of breath or sweating, impending doom, patients feel suffocated and all those things. But the severity of chest pain is very important. In heart attack, it is really usually very severe unless they are diabetic and all those. And sometimes we get preliminary symptoms. Suppose the heart attack may evolve over few hours. At the initial stage, maybe the patient was not having severe chest pain. Maybe the patient was having chest pain only during walking or rising upstairs, like that. And gradually over few hours or few days, the chest pain keep on increasing. So whenever there is a chest pain, central chest pain especially, and if it increases on exertion or there is associated shortness of breath or sweating or unconsciousness, then always rush to the emergency because it might be a heart attack.
So when the patient will feel any kind of heaviness, as you mentioned, so in that case patient can expect that he have suffered from a heart attack.
See, from the patient's point of view, any severe chest pain, he should think of heart attack first. Because the other causes of chest pain, there may be many benign causes of chest pain also, like it can be a musculoskeletal pain, it can be a acidity and reflux acid disease, but those things are to be excluded. So if the patient thinks of an heart attack, rushes to the emergency, we will do an ECG, we will do a troponin test, and then we can exclude other causes and finally confirm our diagnosis of heart attack. So patients at the onset of severe chest pain must think of an heart attack and go to the emergency. That is my point.
Okay, so it means that like once he realizes like he have suffered from an attack, or maybe he is suffering a chest pain, so the first step that he should go, like he should do actually, that he should visit a doctor.
Exactly. He should visit a emergency, and then rest is on the doctors.
So what is the exact treatment for heart attack?
See, if the patient reaches us in time, the first thing we do is we give them some loading doses of certain drugs like aspirin, clopidogrel or other antiplatelet agents, and cholesterol reducing agents like atorvastatins and all those. So these are called loading doses. Now from the loading doses point of view, I just want to mention that even if the patient is in periphery, or even if he is not being able to contact a primary or a tertiary care center within time, or he is in a primary healthcare setup, he should get this loading doses. So our primary care physicians who is serving the patients in the peripheries, in the villages, they also should introduce or should give this loading dose at the very onset of symptoms, and then the patient may be referred to a tertiary care center. Now in a tertiary care center, what we do is we do ECGs, echocardiographies, troponins, and confirm the diagnosis of heart attack. And once we are confirmed about an heart attack, the best possible treatment is doing a primary angiography. Go to the cath lab, do the angiography, see whether there is any coronary artery block or multiple blocks, and then if possible the infarct related artery should be opened up as early as possible. Now after an artery is blocked, the muscles live for 20 minutes. So after 20 minutes passes, the muscles are dying and dying. So as early as possible, if we can open that block, so that spares the remaining muscles from dying, and that is the best treatment for heart attack, and it preserves the heart pumping function and has the best future prognosis. Now if there is no facility for this primary angioplasty, then what we do is we institute certain drugs like streptokinase or rediplase or tenecteplase, which help in diluting these clots partially or sometimes fully. So that is re-establishes the blood flow to certain extent, and then on the next day or after a few hours he may be referred to a center where angiography is possible, and ultimately we need to do an angiography. After an angiography, we need to see how many blocks are there, what is the percentage of the stenosis, the site of the blocks, whether these blocks are calcified or any other complicated things like dissection, and all those are present, and accordingly we decide whether we need an angioplasty or a bypass. So, sometimes patients may be treated by only medical therapy, like those in whom the vessels have recanalized, maybe spontaneously or maybe with those streptokinase or tenecteplase sort of drugs. Otherwise, most of the patients we see that there is a residual stenosis of more than 70%, that is a significant stenosis in the coronaries. So, in those cases mostly they need angioplasty or coronary artery bypass. And then medicines, there are lifelong medicines, there are a big list of medicines which the patient has to continue. He has to maintain certain precautions like diet and lifestyle changes and regular follow-ups.
Okay. So, if like after the treatment, whether it is angioplasty or a bypass surgery, what are the major precautions a patient need to take?
Right. The precautions, most important precaution is medicines. So, the doctor will prescribe a list of medicines, and those medicines have to be taken exactly at time, and the patient has to be very compliant about these medicines. Number one. Number two is lifestyle changes. Lifestyle changes means most important things are stopping smoking or any other tobacco addictions. Dietary changes like reducing fat intake. You have to take a fat restricted diet, and if there is diabetes or hypertension, controlling those risk factors are very important. So, strict control of diabetes, hypertension and dyslipidemia. And then patients, we usually recommend to avoid strenuous job unless it is very mandatory for the patient. So, light activities, avoiding stressful activities, having adequate sleep. Light exercise we recommend, like morning walks or few aerobic exercises after consultation with physiotherapist or dietitians. We recommend those things. Mostly medicines, regular follow-ups with doctors, and these lifestyle changes. These are the precautions. And sometimes after angioplasty or bypass, we according to patient symptoms, we recommend subsequent angiographies to check whether the stents are normal and all that.
So, sir, all these procedures need to be followed once heart attack, like patient have suffered from a heart attack. So, I'd like to know, like from a younger age only, how can we prevent heart attack?
See, we divide the risk factors of heart attack into two groups. One is a modifiable risk factor, one is a non-modifiable risk factor. Now, non-modifiable risk factor are age, sex, gender, race and family history. So, these things you cannot modify. Now comes to the modifiable risk factors like hypertension, diabetes, dyslipidemia, smoking, diet, exercise. So, these are the the areas where you can modify. So, first thing is you have to regularly check for hypertension, diabetes, dyslipidemia, and if they are present you have to adequately control that, number one. Number two is stop smoking and other addictions which may be harmful. Number three is, as I said, that you have to follow a healthy diet. Now, the healthy diet is a separate topic which you can discuss hours for. But mostly what we recommend is less fat, less carbohydrate and more of protein diet, and with adequate increase of fruits and intake of fruits and vegetables, adequate intake of dietary fibers, and especially you have to choose your oil, you have to reduce your oil intake, fat intake, like that. And we recommend physical activities. So, in our generation, physical inactivity is one of the main cause of this heart attacks and atherosclerosis. So, physical activities, and then if you have some additional risk factors like, as I said, homocysteines or apolipoproteins, so that you may consult a doctor and you can take some medicines for that. So, basically it is changing your lifestyle, it is stopping your addictions, it is correcting your hypertension, diabetes, dyslipidemia, and another important thing is, often we find, especially in our country, that people ignore their symptoms. Suppose a patient has a chest pain, history of chest pain while he is walking or he is rising upstairs or in certain exertional activities, but he thinks this is due to acidity or due to certain other problems, so they keep on neglecting those symptoms. So these initial chest pains are preliminary signs and symptoms of heart attack. So if the patient at that stage come to a doctor and intervene and do a coronary angiography, and they do angioplasties or whatever is required before a heart attack occurs, then we can prevent a heart attack. So maintaining a good lifestyle and being very careful about his own symptoms, preliminary symptoms, is very important.
So thank you so much for enriching us so much on the topic of heart attack. For any further queries, kindly drop down your questions in the comment section below. Thank you.